Hello, my name is Dr. Ashwin Mehta, and I'm the Medical Director for Integrative Health here at Memorial Health System. And I'm happy to be bringing to you this wonderful content that has been put together by our Wellness and Resilience Committee, which is comprised of members from throughout Memorial Health System, including Human Resources, Organizational Development, our Memorial Health and Fitness Center, our Cancer Center, Integrative Medicine, as well as Physician Wellness. So today we have two practitioners and natural healers who are going to share some of their wisdom. And Dr. Sameet Kumar is a clinical psychologist at the Memorial Cancer Institute. He has 20 years of clinical experience working with cancer patients, has written numerous books about grief, and has been with Memorial for 10 years. He presents nationally in the areas of mindfulness, resilience, and grief. And we also are joined by Amy Sear, who is our acupuncture and traditional Chinese medicine expert here at Integrative Medicine. Amy, would you like to say a couple words about the work that you do and who you are?
Yes. Hi, everyone. I'm an acupuncturist here in the Memorial Healthcare System. We're at two different locations within the system. I've been an employee for 5 years in our integrative medicine department, and before that I was in private practice with close connection with the Cancer Institute. Of course, I do actual acupuncture, but more parts of Chinese medicine and various Taoist practices that relate to it. So in the office, I do body work, right? There's Chinese Tui Na massage, there's something called cupping, washa, regular massage, and then guidance and information relating to the Chinese medicine model of optimal health. And I'm glad to be here.
Amy, I've been really happy with the services you provided for our patients since I started at Memorial, and we've had so many patients in common who I think universally have benefited through their cancer treatment with your services. And not just, I think it's important to point out, like you did, it's traditional Chinese medicine. It's a whole comprehensive approach to health. What do you feel acupuncture and traditional Chinese medicine can offer people going through this pandemic, going through the lockdown and the transitions that are to come? How do you feel traditional Chinese medicine and acupuncture can help with physical and mental coping for people during this time?
Great question. And listen, first of all, thank you. And likewise, yes. So actually, there's kind of probably a lot of parts to that, but to keep it simple, actual acupuncture, which is something you have to go to a professional and requires an appointment, has a lot to offer. All separate from the pandemic, people still have needs, desires, complaints, and they still need that care, which acupuncture is so comprehensive. But in addition to that, it's extremely relaxing. There are national protocols for stress, quote, PTSD, although we're not all PTSD, but there's so many stressors. There's a lot of even kind of data and research about the neurological, calming, parasympathetic, sympathetic, fight or flight parts. So I would certainly say that with acupuncture and a visit done by a professional, of course. But also there's a lot of nice, gentle herbs that can be very helpful in maintaining basic immunity. I call them herbs that many of us can take, of course, prescribed by a professional, which we do here in the Integrative Medicine Department, but also the body work. There's very specific auricular, meaning the ear, protocols that have been used in same thing, high-level stress, national traumas that, of course, I'm utilizing in addition to everything else. And then I personally teach patients or give them resources that they can go do themselves. So things about breathing, and of course referring to both of you for that. You guys are so good at that. But Chinese medicine has a lot of Taoist. It's just simple ideas, old-fashioned. It's not a religion, but things like cross that bridge when you come to it. methods to stay in the moment, methods to focus on what's at hand and let go of other things. Less is more. A lot of these things have turned out to be very, very helpful, and they all stem from Chinese medicine. So I hope that answers the question. But, also acupuncture is one of the premier holistic full medical models. So what I mean by holistic is not just groovy holistic, but holistic. So we work on treating the whole person, and that seems to work better than just addressing sleep or anxiety.
A lot of people get hung up on the needles. And I can, I'll just say two things before we move on to the other questions from my own personal experience with acupuncture. One, you don't even notice the needles. I notice maybe 2 or 3 needles when they're coming out. I don't even know when they're going in. And the other thing, and I'm so glad you spoke to this, it is so incredibly relaxing. Such a deep and profound state of relaxation that you get when you're laying on the table with those, whatever it is that's going on in Chinese medic, but it is some of the deepest states of relaxation I've ever experienced.
We do know, it's kind of hard to study in the sense of hard numerical data, but there's lots and lots of testing, imaging, brain imaging that, quantifies or are actually happening. Brainwave changes, parts of the brain that I know you're an expert of, that relate to fear versus other emotional states. There's definite information about epinephrine and norepinephrine and all these other markers that seem to kind of balance out and, quote, take the edge off. Some of them are cumulative and have a last sometimes, and some people, of course, they need to keep it up. Sometimes once a month. Some people find once every 3 months is enough. And other people get a profound change after their typical course of about 10 visits, and it holds them for a long time.
I'm glad you spoke to the sort of time frame, because a lot of people come in with different expectations.
Yes.
Regarding how quickly they expect to experience those profound benefits that acupuncture can provide. So. Amy, during our conversation the other day, you also mentioned that there was a very interesting initiative that happened during 9/11 time, and how acupuncture was used specifically to address PTSD in the first responders.
Yes, and kind of to precede that, since probably the 80s, there's been a group that started out of a hospital up in Upper Manhattan that was doing ear, right? They figured out 5 points. It's a protocol in the ear for addiction detox. And data, I mean, there's thousands and thousands of patients. So there was a lot of knowledge on how these 5 points help people, again, settle down, get through that very tumultuous. So coincidentally, 9/11 was up there in southern Manhattan, and there was a school a mile away, a school of Chinese medicine, when 9/11 happened. And a lot of these stress and trauma programs are intentionally begun 2 or 3 weeks later, right? When the dust was settling and there's no opportunity or place. So a church, I don't know the name of the church, ad hoc became kind of a safe space that these first responders would go lay on the pews, go to sleep, doctors started services, they could take a break. So the School of Chinese Medicine nearby decided, let's use this protocol that we know has all these benefits, and let's go over there and set up a mobile shop. And they went through all the legal stuff with the police, and they did, and they found just profound benefits. Now, back to your point, many people in a trauma situation like that feel immediate relief and even report it, regardless of how long it lasts. Some, it took 2 visits, 4 visits, 6 visits. So yes, back to different expectations. Nobody knows, but they even found profound, and these big firefighters with dirt all over them and big helmets would come in and just sit there in a chair. The ear gets cleaned, the 5 needles go in, and they either fall asleep, they pray, release, that's a good thing, the release that, and they feel safe. And then, so what happened is a group of those people started a charity. And then 4 years later, when Hurricane Katrina hit New Orleans, people from all over the country through this charity, the nonprofit, zoomed in and really boots on the ground. And then they came up with a training protocols. So for anyone interested just in what the heck I'm talking, the nonprofit is called Acupuncture Without Borders, or Acupuncturists Without Borders, acuwithoutborders.org. And then, since more national tragedies, they've developed actual protocols, and they even now go internationally and train local shamans and healers how to do this simple technique and trade knowledge. And with this current situation, on their website, acuwithoutborders.org, there's a whole thing about COVID-19, and they have 3 different sections, and one of them shows you how to buy a little kit. Actually, they're giving the kit away to healthcare providers, and it's a little kit of seeds on adhesive. You stick on some points, and they actually show you how to do it on yourself, and this is self-care. So it's not quite as efficacious as an acupuncture visit with acupuncture needles, but I'd say it's right. It's a tool that anyone could use right now, or I'm sure they'll extend it in the future. But this was an evolution of one utilization that led to another, that led to another, and now there's an international program, including a big component for returning veterans. So the same thing, intense, overwhelming, uncontrollable, outside trauma, regardless of on to it. And it just keeps proving itself. And that short YouTube video that you'll be linked to that would show you how you could do this yourself even gives a brief explanation of Vive and what they do.
Wonderful. Well, thank you for sharing that story. We certainly strive to create a safe space of healing here in our integrative medicine clinic. What changes have you made? And we also want to be there for our Memorial community. I know that you have a lot of clients who are Memorial employees who are consistently coming to you for treatments. So Amy, could you explain to us a little bit changes you've made in clinic to ensure a safe environment for your clients as we resume operations here in Integrative Health?
Sure. So the good news is inside the treatment room, I've had to make very few changes because our national industry already had, and we need it even to get a license and to maintain our license and our board certifications. It's called Clean Needle Technique, and it's national standards of universal precautions. So essentially, I only did a little tweaking of that to amp up the extreme focus on touch. So it's just slight changes in the order I do things to do all the non-patient touching, then stop that, wash my hands, do patient touch out other touching, stop that, wash my hands, and then of course because of the electronic medical record and the computers, it's an extra element of paying uber attention to not going back and forth with touch, which we weren't as particular. I always paid attention to, but now it's just extremely amped up, and patients have already reported that makes them feel happy. They can tell, that I'm paying attention. So in the treatment room, very little, but some things, an increase in separating your belongings are way over there, my belongings are way over here. I removed a lot of decorations out of the room, so the room's a little more bare bone to make it easier, faster, more efficient to clean surfaces between patients and at the end of the day and the first thing in the morning. And then outside the treatment room, we've adopted a policy where my patients stay in their car. I run on time, so they know, this is all a very perfectly timed thing. And they stay in the car until they see me open the door. They get out of the car and we come right in my treatment room. And we now do the computer-based check-in process, behind closed doors in one space. So they're escorted directly in. We're finished. They're escorted out. I had to shave off about 7-8 minutes off of the visit in order to do, even extra cleaning between. A lot of the cleaning I do in front of the patient as well, and they seem to like that. So kind of a lot, but not really a lot. And then, of course, I'm fully masked, and every patient arrives with a mask, and they're told in advance they have to leave it on, kind of fully. None of this down on the chin stuff. Yeah. And it's worked well. It's worked well. I've been happy with it. I think everyone should have complete, full confidence. Someone yesterday said, well, this is far better than going to public, so I'm going to keep coming back. So there you go, right? It's true.
Are you selling toilet paper also? No. Just kidding. Just kidding.
So anyway, I hope that answered the question.
Absolutely. No, I think people can rest assured that there will be no crowded waiting rooms, that,
Yes.
We've done all that we can to maintain
and no touchy. That's my new mantra. When you walk in, no touchy. A lot of it is just paying attention to all that dumb touching you didn't know you were doing, me or them. And that helped. The mask and the touchy, that's what I call it works.
So just in closing, what can we learn from the philosophy of traditional Chinese medicine to help us address stress during this time? I mean, it's kind of a question that you've already alluded to, but if you could just expand on how the philosophy is so applicable in this day and age, that'd be great.
Sure. So Acupuncture is actually a medical technique that you could separate from principles and philosophies if need be. Many of my colleagues they're not so much in the philosophy, but the entire theoretical and application is built on, quote, Taoist principles. That starts with a D or a T, Taoism. And that is about simplicity, balance. Balance is very helpful. Like for me, I'm already very balanced, but when this was happening, I was like, okay, Amy, what's your bottom line? What absolutely matters now still? And what doesn't? And maybe it'll come back, but I'll be okay. So this idea of keeping things simple, staying in the moment, prioritizing. Taoism has a full-time principle of reducing expectations, a key idea of happiness, chi flow, organs working is to figure out, what expectations are required and which are all that extra stuff that our culture or our upbringing or whatever might get in the way, right? So being clear about and reducing expectations, kind of like what everybody calls the new normal, which is kind of being overused, but the idea is adapting and figuring out my new expectations. Balancing out activity with balancing, making sure to get enough sleep. Of course, healthy, balanced eating with the seasons, eating with the different flavors, and a lot of Taoist principles. There's a lot of simple books out there. This is what I work with my patients. Very simple, inexpensive, direct, easy to assimilate kind of guides to some of these principles and then how to apply them.
Fantastic.
Yeah, I think these days it's really uncharted territory for all of us. All hands on, whatever works is essential to start putting into practice. And Along those lines, I know Dr. Mehta, you've been talking about, and a lot of our patients have been benefiting from aromatherapy, and those kinds of ideas a lot of people don't normally consider, but they can be so profoundly healing and grounding and helpful. I know you wanted to talk a little bit about that today also.
Sure. Well, thank
and
you.
chi flow. The last thing is chi flow, right? We have to have kind of chi to dry organs, but it has to flow. And so if we're idle too much, or tension is the number one thing that blocks it. So that's a Chinese medical principle that's at the heart of this. So essential oils.
So, essential oils used in the context of aromatherapy actually can get the chi flowing. My interest in aromatherapy actually was grounded in my practice of sleep medicine. So oftentimes people were coming in, after having used sleep medicine or, medications, prescription medications, to get better quality sleep for quite some time, and they wanted to reduce their reliance or dependence on these meds. And aromatherapy combined with mindfulness and certain adaptogenic herbs was kind of a good way to get people off of the long-term use of sleep medications. So, they did a study in Johns Hopkins University looking at lavender oil aromatherapy, which I recommend quite routinely. Lavender as well as lemongrass and lemon balm all have promoting anxiolytic properties. They kind of chip away at the anxiety. They've been shown to reduce blood pressure in clinical trials. And, the downside risk of using aromatherapy is really small. I'd encourage everybody to kind of be your own little aromatherapist. And it's not too hard to do. So what I would recommend is just taking start with a wood base. That can be, cedar wood, it can be sandalwood, it can be a couple of other, frankincense is also a really great bark, the sap that comes from the bark of these trees. Usually using that as kind of a base, and then using other parts of the plant. The leaves can be mint, can be holy basil, flowers. I mentioned lavender, but rose can be used, geranium can be used. And then the fruit essences can also be used. So really good combination is dense with any citrus, citronella, lemongrass, and then a flower, and then a leaf and a fruit, as well as the bark. So if you just combine those and experiment with some of those, you can be your own aromatherapist and use essential oils to your advantage to create a really profound effect. Some of these can elevate mood. Some of these can help calm us, and they're really part of they can be a really great part of a bedtime routine.
Yeah, I know personally as a psychologist, mental health care practitioner, there's some things you can't just heal with words and with our own activity of the mind. The aromatherapy for me has been so effective, and it's, I think, worth pointing out, shortest route to the brain.
Yes.
And it's one of the most primal senses that we have. And to just kind of, I think a lot of people are skeptical when they hear about aromatherapy. Like, what are you talking about? Yeah, try it.
Well,
and,
I think because
it's pretty amazing.
They've been led to believe, or they've presumed that that's for making your house smell pretty, or for those other ideas. And Dr. Mehta, that the woods come from Chinese medicine and happen to have antimicrobial behaviors. So obviously we're not going to overstate what that means. It's not in lieu of all the other cleaning, but the idea of the aerosol aspect, but it has to be kept to a minimum, right? If you do it too much, you can actually injure your lungs. And several that you mentioned are herbs in Chinese medicine that end up in formulas for allowing free flow of qi, right? So relaxing any impediment physiologically of qi flow. So these all overlap and reinforce each other in action. There's no contradictions here.
And thank you for sharing that. So, I'm really happy that we had an opportunity to talk about, two modalities that are really kind of central components of integrative health, namely acupuncture, traditional Chinese medicine, and how it's rooted in, improving the qi flow, being in the moment, certainly, harkens back to our dialogue regarding mindfulness and meditation as well. And then in combination, using essential oil aromatherapy with what types of essences really suit you and can be made part of your routine to help reduce stress and anxiety during this very challenging time. So
Sure.
Thank you, Amy, for joining. You're a great healer, and you have a fantastic reputation, and it's nice that acupuncture covered under Memorial's insurance for our own employees. So here, as we ramp up our clinical operations, we want to certainly encourage a lot of your longtime clients to come on back, and then other people who have not experienced acupuncture for themselves to give us a call here at Integrative Health. Our number is 954-844-9080, and we've got a really comprehensive team who are ready and willing to help put your wellness through some of these healing modalities. So thank you all for participating, and do stay tuned for additional content. Next week, our virtual wellness dialogue will cover the benefits of yoga and therapeutic yoga breathing techniques, and how those can be applied for better physical and mental health during this COVID pandemic. So thank you all for your participation and enthusiasm, and looking forward to joining you